professor, physician, epidemiologist. I am Dr. Sri Banerjee. Hello, everyone. I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And in this video, I'm going to be going over the specific types of topics that are covered in the Centers for Disease Control, specifically the National Center for Chronic Disease Prevention and Health Promotion. This is one of those foundational public health sort of grouping agencies that you should be familiar with. And so this sort of interactive data application dashboard, they're so commonplace these days that I think it would be important for you to look into all the types of data applications that are available. So the reason I introduced this is because when I was looking through this, one thing that really caught my attention was the latest sort of data and statistics that's available. And so data and statistics by topic. So if you're looking for a topic to kind of hone in on and focus, this is another good place that you can look at. And it gives you about 16 topics to look at. And those are, it's not just any topics. One of the things that is actually sometimes difficult to know is it's not that there's a lack of the number of research gaps or topics, but how do you select the one that you are going to be most interested in researching? So if it's something that you're going to just look up quickly and it's not really, doesn't take too much time, then it might be some information that you don't really care too much about. But if it's something that you are going to be investing months, years, time, money, and sometimes certain topics, one specific topic, people will research for years on end. That's what sometimes that's what a PhD is. So then you want to make sure that you have collected good evidence, and you want to find places and repositories like this one where that can be done. So the other important portion, of course, where I started was the interactive data applications. And there are some really good ones that have come up over the years. More recently, the Alcohol and Public Health, Alcohol-Related Disease Impact, Behavioral Risk Factor Surveillance System. Of course, this has been there for years. Good for prevalence and trends and state-level data. That is one of the strengths there. And then, of course, chronic disease indicators, chronic kidney disease surveillance system, diabetes atlas, and so this is all giving good up-to-date information. Global tobacco surveillance system data, healthy aging portal, heart disease and stroke prevention data trends and maps, interactive atlas of heart disease and stroke, places, local data for better health. So I just listed you a whole list of names. I didn't do this just for the sake of reading out a list of names. It's very important to be looking into these. I want you to explore each of these. I've actually spent a lot of time in most of these data sets. BRFSS, I have a number of research articles in this. And places I've used. I've also used a combination of some of these in other dataset repositories. So that's just the ones on the left. PRAMS is a famous, very famous pregnancy risk data set to look into, nutrition, physical activity, and obesity, data, trends, and maps. Office on Smoking and Health's interactive data dissemination tool, that's a good one. Oral health, state tobacco activities, U.S. cancer statistics, vision and eye, and of course, youth risk behavior surveillance system. And some of my students have done topics on this interactive data application. So these are existing. It's a combination. It's two things. It's a combination of existing data applications, and then the second part is existing topics. So you put these together, and then you have an open data portal where you can also further explore the nature of chronic diseases. So this basically comprises everything that you have available at your fingertips, and I think I would say that this is a lot of information. Another area, really, health-related quality of life, I think deserves some exploration, but also national assisted reproductive technology and surveillance systems on that, infertility clinics, and how all of those work, national adult tobacco survey, national health interview survey. So I'm just listing to you some ones that kind of jump out. U.S. diabetes surveillance system. I'm a diabetician, so that's one of my interests. So that basically sums up a lot of the data sets that is at your disposal, and also it comprises some of the interactiveness of this, and how you can use this not only to assess needs in different places, but to address them through creating a profile and assessment. Then you can address them adequately. But more importantly, address social determinants and address needs in a targeted fashion. So that's the highlight of this. And so chronic diseases can be investigated in this manner, and I encourage each and every one of you to visit the National Center for Chronic Disease Prevention and Health Promotion, NCCDPHP. Thank you for listening.